a last-ditch effort to expand government health insurance to Kansas working poor, plus demands to open up Kansas as lawmakers try to finish their work for the year, and the pièce de résistance, a mega COVID bill covering everything from telemedicine to the governor's emergency powers. That's what we're talking about right now on Kansas Week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage of the COVID-19 pandemic in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.
Thursday of this last week may have been the longest day in Kansas legislative history, and a whole lot happened you'll want to know about. Good evening, I'm Pilar Pedraza, and this is Kansas Week. Starting with the GOP leadership's efforts to limit the governor's power in a state of emergency, we had some major changes to state law. Lawmakers just passed the COVID bill Friday morning. It protects many of the changes Governor Kelly has made in the last few weeks by executive order, such as allowing doctors to prescribe narcotic medicines to patients via telemedicine without an in-person visit. It also limited liability for businesses in the case of a COVID outbreak. But the biggest portions of the bill strip the governor of some of her emergency powers. It takes the federal aid monies Kansas has gotten away from her office and gives it to the Legislative Coordinating Council to oversee. And it prohibits the governor from making any new COVID-related disaster declarations without express approval from state lawmakers, and limits her ability to shut down businesses to just 15 days, again, only with approval from state lawmakers. Supporters say this is about making sure there's legislative oversight of the process. Opponents say this is about punishing Laura Kelly for what's happening in Kansas and in every other state in the nation.
The governor better veto this, because if she doesn't, we're going to fight the war against COVID by committee. And you don't fight wars by committee.
This is where collaboration begins. Now's the time for the governor to sign this legislation into law so that we can begin working together. Our constituents want us to reopen Kansas safely.
Finally, people are going to be in a place where they can have some confidence stepping forward, knowing that there are legislators on their side that want to get Kansas open and want to get Kansas back to work. And that's all that people want.
Now, this is not finished. The governor has 10 days from the moment she gets the bill to decide whether or not to veto it. So a lot of questions on what's going to go on here. And here to dive into these issues with me, we have Dr. Neil Allen, Wichita State politician, Wichita State political scientist. I apologize. I'm very sleep deprived right now.
Two different things.
Yes, I know. And joining us by Skype, we have Diane Leffler from the Wichita Eagle. Thank you so much.
Good to be here.
Okay, so Diana, did you stay up all night like I did, or did you do shifts? Okay, I couldn't remember. We were kind of skipping past each other there.
All 23 hours, 55 minutes of yesterday's session.
Yeah, a lot of thoughts that this may be a record for length of session. Certainly a record in my experience.
It's hard to remember. I mean, we've had days where it kind of like spilled over into the next day at the end of session, but sometimes it's hard to remember now whether those were actual single units of time, or if it was just there were so many different things going on in so many different places that we had to be in all of them at once.
Lack of sleep will do that to us. That's for sure.
Yeah.
But Neil, a lot of this bill is huge. It's more of an omnibus bill, packaging several different issues into it. Not exactly your normal end of session legislation.
Well, I mean, we often see kind of omnibus bills at the ends of session, but normally it's because there's a lot of built-up work because of all the things that have been happening in the session and all the different issues that people are working on. But in this case, it's what's unique is that, I mean, there was a massive shift in some ways you might say the constitutional structure of the state government that actually happened during this 23 hours and change of debate. And in particular, I mean, it's going to make us fairly unique in how we're dealing with the COVID crisis, which is to set up a legislative board to okay governor's decisions every couple of weeks, and also empowering counties to act in a way that sometimes is against the governor's orders. And also in Kansas, with the massive amount of counties that we have, that could lead to lots of divergent policy outcomes.
Now, I know one thing that they did is they put in a confirmation of a lot of the executive orders and also her emergency declarations in this bill. I've heard very specifically from some lawmakers in the Republican Party of the State House that the point of that is to force her to sign, because otherwise the Attorney General has opined that if the legislature doesn't confirm those actions, they're invalid. And basically we end stay at home and any confinement in Kansas immediately.
That's right, and it's a complicated question because the question, as I understand it, hinges upon whether Governor Kelly can have a second emergency declaration for the same emergency. Although Governor Kelly could clearly argue that COVID-19 is creating a number of emergencies, and the emergency today is different than the emergency that was occurring in February. And so this is the thing that might have to be settled in the courts. It's also complicated by the fact that Laura Kelly's going to have a Republican opponent in 2 years, and there's a good chance it might be Attorney General Schmidt. And but we have a unique situation here in Kansas that we actually were a Republican state with a Democratic governor, and one who's pretty popular, and whose relationship with the legislature is complicated at best.
A very good way to put it, complicated at best. Diane, you and I have been covering the State House for years now. As we look at this, does everything that happened over the last couple of days help or hurt the governor?
Well, it depends on how the governor handles this. I think, I mean, from the provisions of the bill, if she signs the bill, she becomes basically irrelevant to the COVID-19 pandemic effort. If every county of 1,200 people in the state of Kansas can overrule her decisions, then they simply become guidelines, suggestions. So there's really nothing. I just don't see what she would get out of this. Yes, it does uphold some of the executive orders that she's ordered. But on the other hand, the only holdback on those right now is this Attorney General's opinion, which came out, and a lot of people are pretty angry about this.
Yeah, it came out the morning of basically this last day of the session, and even Republicans were upset that it came out, the timing of it.
Yeah, so I mean, there's, and Attorney General's opinions are opinions, and they do have some legal force up until something goes to court, but and they can be taken as guidelines too.
Yeah, and also I think that there's probably some in the legislature, conservative Republicans, that would like to pass the legislation they passed and have Laura Kelly veto it, and then have her maintain her authority, because then difficulties involving COVID response then are more owned by her and less by the legislature. But they've still taken a position that helps them in their primaries and makes an argument that they are for reopening and for opening churches and things like that. But I would be real surprised if Governor Kelly doesn't veto this, because Diane's right. This really is totally changing her role as a governor, and in some ways makes her even less powerful than normal in a time when every other governor is more powerful. And it just, the incentives are all for her to veto and then see what happens.
Well, to veto or not, that's the big question. Governor Kelly gave us a first glimpse at what her response might be in her response to the way things happened on Thursday when she spoke to the media Friday morning.
I've not had much time yet to reflect on the spectacle that transpired on the third floor of the Kansas State Capitol last night and this morning. And just like the entire Kansas legislature, I also haven't had an opportunity to read or review the complex and consequential legislation they passed in the middle of the night. Therefore, I will confirm up front that I have no intentions of announcing my plans for specific bill signatures or vetoes this afternoon. But I do think all that transpired yesterday, overnight, and this morning can be encapsulated in a single question raised by one lawmaker on the floor of the Kansas House of Representatives.
Mr. Speaker, could I ask that we not throw paper airplanes in the chamber during debate on this important legislation?
I wish that had been a joke. I wish it had been some sort of metaphor. I also wish that this had not been the most embarrassing, irresponsible display of governing that we have witnessed throughout this ordeal. These chambers are designed to serve as a marketplace of ideas. The process is intended to be boisterous, even passionate at times. That said, there should also be no illusions whatsoever that the process is free of flaws. It is a human endeavor, and therefore mistakes are baked into the equation. Even at the height of tensions in the lawmaking process, a process that is inherently political, there have historically been things that Kansas legislators just don't do to each other or to their constituents. Yesterday, throughout the night and this morning, so many of these time-honored decorums were thrown out the window when they were needed most.
Now, that's a pretty blistering response from the governor in a very calm tone of voice. But what can we take away from that? What clues are there in what she had to say to what we can expect from her?
Well, on one hand, I mean, it is the governor making a process argument. And there's a certain argument for moving very fast at the end of session, no matter what the session is. But also, we've been talking as a state about Governor Kelly's authority for a while now. And for example, Senator Wagle, who's a state Senate president, she's been using the term dictator for a few weeks now. And if there would be a strong criticism of the legislature and how they handled things, it would be that they knew what they were doing for weeks, that they had serious concerns about the governor's decisions and the amount of authority she had. And so the text of the bill, or at least the general principles of the bill, could have been aired publicly before then, and we could have had the discussion about whether this was a good idea or not. And I mean, we even had a situation where I think it was like 4 o'clock in the morning last night, there was going to be debate on bills and nobody could find a copy of it at the time.
I had copies of it that I had found, and so I had some folks tweet as saying, anybody know what the text of this is? And I'm like, here's the link. And so a reporter telling politicians, this is where your work is at, is not the normal situation.
Well, and also think about this way. If a citizen wants to be involved in this discussion, how are they going to do that? Is there any, even if the citizen's going to stay up to 4 in the morning watching the live stream, like how are they going to influence this particular decision, except for maybe to rely on the fact that a week ago they posted somewhere saying either open up quicker or Kelly's a dictator or we should restrict the governor's powers. But really this is taking things and just encapsulating entirety of a massive debate about our governing arrangements and doing it at 4 in the morning without a clear common set of facts. But also I think most likely the governor's going to veto, and then we'll see what happens after that.
Well, the timing issue and public input is definitely one of the most common complaints about these Kansas legislature after midnight sessions that we have every once in a while. Dion, as you listen to those comments from the governor, what clues are you seeing in there based on your experience at the State House?
I think she's signaling that she was not very happy with what happened. She was a senator before she became the governor, and I think that there's still a little bit of senator in her, and I think that was the display of raw political power by the Republican caucus in the Senate yesterday was breathtaking. They didn't allow debate on bills. They simply called the question as soon as the motion was made and shipped it off to conference committees, which of course the Republicans dominate. So, you know, there really was a tone set there, and that tone was, you know, we control this, and you know, Dr. Allen was saying the public doesn't have a chance to weigh in. Democratic legislators didn't have a chance to weigh in.
Republican legislators didn't have a chance to weigh in.
Good point.
Yeah, I heard from both sides of the aisle some complaints about not being able to offer amendments or debate topics.
Yeah, I mean, it was not the normal process. I can tell you that I was fairly shocked when they just simply called the question immediately on every single piece of legislation past the first one.
Yeah. Well, and one thing that we did see is there were a lot of things that were on the topic or on the agenda for this session. They did pass several other bills, not just the COVID bill, but there's one issue that a lot of Kansans wanted to see, and it didn't happen. Let's take a look. 200 or 300 people gathered on the State House lawn for a rally organized by the Convention of States. While signs and complaints ranged from LGBTQ-friendly laws to mandatory vaccinations and contact tracing, most spoke about opening up the state. Dan Krager of Shawnee is a small business owner who came out for the rally. He says stay-at-home orders didn't help anyone. It just hurt their pocketbooks.
You no credit for brains, and now when they don't give you credit for following rules, according to the Constitution, that's too much.
Earlier in the day, a handful of Medicaid expansion supporters gathered outside the entrance to the State House parking garage, greeting lawmakers as they arrived for the day. They were upset Medicaid expansion wasn't on the agenda today, saying it's needed now during the pandemic more than ever. Democrats tried to force a debate earlier in the Senate, but failed. And I'll apologize for that. I warned you I was sleep deprived. I made an error and jumped stories a little bit here. But in some ways, these demonstrations and protests did the same thing to the legislative actions on Thursday. You know, just kind of coming in and interrupting everything, although they didn't come in like they normally would. Everybody was outside this time around.
Well, there's that's important. And also, I mean, we've had some fairly high profile inside the Capitol protests, particularly involving Medicaid expansion and banners, and there's been a lot of questioning about journalistic access and public access. But something important to note here is that that on Medicaid expansion, there are majorities in both houses of the legislature for a Medicaid expansion plan. Now, in the American system, often a simple majority is not enough. And if the supporters had 2/3 in the Senate, the Medicaid expansion would have passed. But also, this isn't over either, because we have elections in the fall. Several Republicans, and conservative Republicans in particular, are going to be in trouble for re-election. A couple of Democrats, but there's a good chance we're going to have more Democrats in the Senate next time. And so we haven't seen the last of Medicaid expansion. But also, whenever a leadership of a chamber has an issue that they don't want to have voted on, but there's a majority for, it puts them in a very difficult position. And so we saw it last night whenever the Democrats got pretty close to getting a vote on Medicaid expansion in the Senate. And if they did, because of how the Republicans were running the debate to move fast, then that could have led for immediate concurrence by the State House, and Medicaid expansion could have passed, you know, in basically a bit of luck and skill by the Democrats and the moderates. Now, it didn't, but it just shows how complicated it is to do all these things really fast all together.
Yeah. Well, we'll talk about the Medicaid expansion effort in a few minutes here, but Dion, as we look at those shots of the protesters out there, did they seem to make any impact on lawmakers? I certainly didn't seem to see a whole lot of reaction inside the State House.
There wasn't a lot of reaction inside the State House, but it was a fascinating protest. Susan Wagle went out and spoke to the protesters who didn't feel that she was extreme enough. She is one of the leading advocates for, you know, opening up the state. But when she mentioned that she wanted to do it in a safe manner, people were saying stuff like, safety's ridiculous. Open it all now. And it was a very, very, very tough crowd. If you were not of the conspiracy theory mindedness, and another nice little touch was they had like Chinese flags, and they threw them on the ground so that people could like stomp on them. It was an interesting gathering of about 125, 150 people.
How much of it that do you think is because of the organizers behind the rally?
I don't think they needed an organizer. I think these folks, there were, there were several strings that were kind of coming together. You had people, that were anti-vaccine. You had people that, people were, waving signs that the Convention of States people were out there. There was all kinds of, all these sort of right-wing groups just kind of have come together on this, and they're sharing a lot of pollen right now.
Yeah. Well, certainly a lot of talk about that, but that wasn't the only thing. As we said, Medicaid expansion was discussed at the State House. When lawmakers left early due to the pandemic shutdown, it had been one of many bills that was left behind. Leadership did not put it on the very short one-day schedule for this week, but supporters tried to change that.
Desperate times call for desperate measures. People in Kansas are desperate.
Before the session started, it seemed like Medicaid expansion was going to happen in Kansas this year. The governor and Senate Majority Leader Jim Denning reached a compromise deal with 22 senators in support, more than enough to pass it. But the bill has yet to come up for debate. So supporters tried to add it on to other legislation being worked here on the Senate floor this morning. But despite emotional pleas, they failed. Senate President Susan Wagle says that's because of the state Supreme Court's ruling on abortion earlier this year.
Senators who were for Medicaid expansion then changed their mind because they don't want Kansas taxpayers funding abortions through all 9 months of pregnancy.
I know people that didn't have insurance. They were afraid to make a medical bill, and they waited till the last minute to go to the emergency room at Via Christi in Wichita and Wesley Medical Center, and now they're dead.
It took only about 15 minutes for the effort to fail. Senate Minority Leader Anthony Hensley says Medicaid expansion is dead for this year, but they won't give up on trying to pass it in Kansas. Very much something that we've been seeing over and over again over the last few years. But as you've mentioned earlier, a lot more strident and vocal support for it in the last couple of years. And while Anthony Hensley said it's dead this year, they're not giving up. So the future of Medicaid expansion, does it eventually happen in Kansas or not?
My guess would be yes, partly because we know that Governor Kelly is going to be the governor next year. And all you have to do is get a majority in both houses after you get it onto the agenda. And most likely, I think the Democrats will pick up some in the state Senate, and the state House, had a majority for it last time. But I mean, what we see here is the nationalization of our state politics. And so just in that package, we could see two people that want to be the next U.S. Senator from Kansas. One, Barbara Boyer, the Democrat who's going to be their nominee, and also Senator Wagle, who's a running, probably third right now in that primary behind former Secretary of State Chris Kobach and Roger Marshall, who's a U.S. House member. Notice this week he got in the news by saying that he and his family and his patients are taking hydroxychloroquine, which is Donald Trump's favorite drug to talk about. And so Barbara Boyer, who's also a doctor, would probably like to have that kind of discussion in the fall. But you got to win your first election first. And a Republican primary in Kansas is going to be one where people like Donald Trump, and also they want to stop abortion. And so Senator Wagle's positioning makes a lot of sense here. And so when you've got national and primary kind of incentives going on, it just, whether Medicaid expansion passes or not is not what's on necessarily everyone's mind. But it's, but this is a really hard time in American politics for people to get together calmly to make decisions. But the trouble is, in the middle of a COVID pandemic, that's hopefully the worst thing that any of us are ever going to experience in our lifetimes, what we really need is people to calmly get together and make good decisions. And last night / this morning was not the best example of that.
And Dion, the abortion issue, we knew that ruling was going to come down sometime this year. Did it perhaps provide an excuse for some politicians who are in maybe more purple districts that they could come out as being in favor of Medicaid expansion, but then have a reason not to vote for it?
Well, I mean, yeah, there's some of that. The question all along has been really, does the legislature even have the authority to stop the governor if she were to want to go ahead and expand it? It was originally presented to the states as the governor's choice, and most governors have done that. But it resulted in litigation, but litigation, I think, should have a chance to win. It's become, Medicaid expansion has become a very valuable campaign issue for the Democratic Party and its candidates, almost as much as the abortion issue has become a valuable issue for the Republicans and their candidates. So politically, better have the argument than win the fight.
All right. Well, this has certainly been a very interesting week when it comes to Kansas politics. Neil, I'm going to end with you. What is the biggest takeaway from this week?
Well, there was a national poll by SurveyMonkey that looked at every governor's approval rating, and right now Governor Kelly is sitting at 66%. And so outside of Senator Moran, she's the most popular politician in the state right now. Now that doesn't necessarily mean it's going to happen for forever, but she is in an extremely strong position. Okay. And also Democrats, if they can talk about health care, they're real happy.
All right. Well, Neil, Dion, thank you so much for joining us. We're out of time for the day. I hope you've enjoyed our discussion. If you want to continue it, please email us at kansasweek@kpts.org. For now, have a great week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.